sugarcoating what you should know about HIV and diabetes. So I know a lot of you in this room, but for those of you who don't know me, my name is Jen McPherson, and I'm the Treatment Health and Wellness Coordinator at Positive Living BC, also a registered dietitian. And I'd just like to welcome, right now, we'd like to welcome all of our members who are here, all of our interested healthcare professionals from the community, and especially to those members who have come from out of town, because I had a lot of RSVPs from out of town tonight, so that's really exciting that you were able to make it into Vancouver for our tonight's forum. I should let you know that tonight's forum is being video recorded for addition to our Positive Living BC website, but you don't need to worry because fortunately for you and unfortunately for me, it'll be focused right here on the speaker for the entire evening. The washrooms are located directly out the back doors and to your left. And I'd like to remind you to turn off any cell phones at this time so we don't interrupt our speakers. And following tonight's presentation, we'll have about half an hour for our question and answer session. So if you could hold your questions until the end of the presentations, that would be ideal. And lastly, you'll see some evaluation forms on your tables. So those evaluation forms we use after the forum to decide what our next community forums are going to be about. And we really take all of your feedback seriously at Positive Living, so we encourage you to take your time and make sure that you fill those out as the presentations go on. So, without further ado, I hope that you all enjoyed the lovely meal. We should thank Anne Merchant and the Chateau Granville staff for that lovely meal. And now I'd like to welcome our first speaker. So Dr. Bondy is a clinical associate professor of medicine and pathology at the University of British Columbia and director of the HIV metabolic clinic at St. Paul's Hospital right here in Vancouver. He earned his MD from the University of Toronto and did his postdoc training at the University of Western Ontario. So Dr. Bondy's research interests include dyslipidemias, type 2 diabetes, obviously, and metabolic abnormalities associated with HIV therapy. So in addition to his clinical and research activities, he's extensively involved in undergraduate, graduate, and residence teaching. He was the director of the Principles of Human Biology, which is taught in first year medicine, and the co-block chair of the Endocrine and Metabolism block, which is taught in second year medicine. So without further ado, please welcome Dr. Bondy.
Thank you, Jen, for those kind words. And what I'd like to do in the next 30 minutes or so is go over diabetes with respect to HIV. As I'm going to show you, actually, I treat people with HIV pretty well the same as I do for diabetes as I do non-HIV individuals. But there are some special features, and I'll outline those as I go along. So we're going to look at basically why you get diabetes. I'm going to have a case that I'm going to specifically address specific features of HIV itself with regards to diabetes. I'll very briefly touch on lifestyle options. Karen is going to do much more justice to how you control it with diet. And lastly, I'm going to tell you about the medications used to treat diabetes with special considerations for HIV. So with regards to diabetes, we really do have an epidemic of this problem. Here's some data from Ontario. And basically, as you can see, in terms of people living in Ontario, from 1994 to, in this case, 2004, it's gone from about 5% of people to close to 9%. And if you extend that line, it keeps going. In another 10 years, this will be reaching close to 20% of the population. Diabetes is really becoming a very common condition. Why that's happening is probably multifactorial. We don't exercise as much as we should, and we do have an aging population. As people get older, they get at risk for diabetes. Now, in terms of what problems diabetes can have, as you can see, there is some encouraging news. On the top is the mortality rate, people who die from diabetes. Okay? You're welcome. The mortality rate with time is going down. So there's probably a number of reasons for that. We're probably picking diabetes up earlier. We have effective drugs to treat the complications of diabetes, which includes heart disease, kidney, and your eyes. Now, with regards to the goals of treating diabetes, one number you should always remember as a diabetic is what your hemoglobin A1C is. Hemoglobin A1C is a tool that allows us to determine what your sugars have been doing in the last 3 months. Basically, it's a very simple test. You take red blood cells and you extract a protein called hemoglobin. You measure the amount of sugar that's attached to it. And this red blood cells generally last 3 months. So the higher your sugars have been, the higher your hemoglobin A1C is. Now the target, as I'm going to show you, is an A1C under 7%. Now you might ask, what's a normal A1C level? Basically a normal one is around 6 to 6.1%. Indeed, if your A1C is above 6.5, that is diagnostic of having type 2 diabetes. In Canada, our goal is to get it under 7%. Now, when you take people who have type 2 diabetes and look at the percentage of people hitting that goal, it's only about 52%. So half the people who have diabetes are above the goal. So we have lots of room to improve this. It's probably, again, a combination of factors, including people with diabetes really don't feel any differently. The vast majority of people who present with diabetes feel absolutely fine. Now, what were you taught? What was some of the symptoms of diabetes? What do people feel? Sure, in the back.
Yeah, frequent urination.
Okay, so frequent urination. You're tired, that's another one. Any others?
Thirst.
Thirst. Okay, that's again, poorly controlled diabetes will give you that. Actually, the number one tip that you got diabetes is how often you get up during the night to pee. And actually, you can actually, you know, if a patient comes in and says you've got to get up every hour to pee, you can almost guarantee they have something wrong with their sugar control. Okay? The other feature that you get in type 2 diabetes is people will complain of numbness in their feet. Now, of course, that's a bit difficult in people with HIV because neuropathy is so common. Okay? So again, you always got to guess what's going on. But certainly in a lot of people, the first thing they say when they come into your office is, my feet are going numb, and I don't know why. If you do a blood sugar on them, it will often be elevated. So, this is a bit of a sad situation. I like this guy. He's a wolf eel. These are from BC, and I really enjoy wolf eels because I'm starting to resemble one. So to introduce the topic of type 2 diabetes, I'm going to show you a case, a very simple case. This is Mr. Jones. I didn't come up with a very elaborate name here. He's 59 years of age. That's actually young for guys. Actually, as I approach, actually I'm 59, so it's a bit scary. He's had HIV for 15 years, so he's an experienced individual. Now, he's had diabetes for about 5 years. In terms of his weight, he's got a BMI of 32. That tells you he is overweight. In fact, if you measured his belly, you would find that his belt size is over 40 inches. That's an important consideration. Many people who have type 2 diabetes, probably 90% of the people with type 2 diabetes have central obesity. And that's one of the reasons you get diabetes. Basically, as you get a big gut, your ability of insulin working well diminishes. Now, most people who have big bellies don't get diabetes. You need a second hit. And basically, that second hit is your beta cells that make insulin, in some people, start to die. And when you lose your beta cells, they never come back. So when people make the diagnosis of diabetes, generally you've lost 50% of the cells that make insulin, and they're not coming back. So that's why, in many ways, diabetes is not reversible. because once you've lost those 50% of your cells, it's difficult. You can't make those cells grow again. It is true, however, if you lose weight, you'll put less stress on those cells, and often you can reverse diabetes by getting people to lose weight. So getting back to the case, as I told you, A1C is our feature goal, and in this case, his A1C is 8.6%. It's too high. And he's at 1.5% too high. FPG means fasting sugar. That's your sugar before you eat in the morning. This is around 10. That's, again, too high. Ideally, we want it between 4 and 7. PPG stands for postprandial sugars. This is your sugar after you eat a meal. Now, the vast majority of you here, your sugars won't rise above 7 or 8 even after a meal. In a diabetic, that's a major defect. When you eat meals, especially carbohydrate, your sugar goes high because you're not able to make enough insulin. In terms of his other lab, we're not going to discuss that. His kidneys are fine, but basically his main problem is his sugar's too high. He's on a bunch of pills. He's on metformin. I'll tell you about metformin in a minute, but metformin is the #1 drug we use to treat diabetes. It's a drug that improves the way insulin works. The other feature of it is it's been around for 50 plus years. It's really quite a safe medication. The main drag with metformin is it causes diarrhea. About 20 to 30% of people who take metformin will get gas and diarrhea. If you have HIV, you don't need any extra burden that way. He's on a blood pressure pill. He's on a cholesterol pill. In terms of his antivirals, he's on this cocktail. He's on atazanavir, ritonavir, and truvada. The early antiviral regimes, especially drugs like Crixivan, they caused insulin resistance. So protease inhibitors themselves, especially the early ones, cause insulin resistance and could precipitate diabetes. Our current antivirals are much more metabolically friendly. Okay? And again, in this case, he's on a lower dose of ritonavir. He's on 100 milligrams. Ritonavir causes a lot of metabolic issues, but if you use a lower dose of it, you get a lot less elevations in your sugar, and your cholesterol is often not affected by it. Okay? So, in terms of what I ask is, in this individual, his sugars are high. What you'd like to find out is where the defect is. So the way you do that is to do glucose monitoring. It's a very effective tool. Basically, you measure your blood glucose using standard glucose meters. And the benefit of that is it gives you, it empowers the patient to say what things make your sugars go bad, what things make your sugars improve. So in this case, especially because his sugars are out of control, I asked him to measure his sugars fairly frequently. Usually I don't ask people to measure their sugars more than a couple times a week. In this case, because his sugars are out of control, he measured it before breakfast, after breakfast, before lunch, et cetera, et cetera. And as you can see on Monday, his sugars were high in the morning, and after he ate, they were high as well. So he's got both an elevation in fasting and an elevation in post-breakfast. And that's consistent. The other thing you look for is there any really high sugars? And as you can see, he has had some readings that are 14. Some people, you can get sugars as high as 20, 24. When you get sugars really high like that, you get symptoms. You start peeing, you're thirsty, et cetera, et cetera. But it's always amazing to me, a lot of people who have really high sugars still have absolutely no symptoms. The problem is those high sugars are eventually going to catch up with you. Any idea what's the most common cause of death in a diabetic?
Stroke?
Okay, I hear stroke, that is, but it's not the most common. Renal failure? I hear renal failure, but that again is not the most common. It's coma is actually not as common. It really depends on what regime, but actually we don't see people with comas much anymore. It's actually getting a heart attack. Okay? So the #1 killer of people with diabetes is getting heart attacks and stroke. Okay? So that's really why we take it so serious, is if you got diabetes, your risk for getting heart disease at least doubles, it probably increases almost fourfold. So that's a really important. Now, you mentioned kidney disease. Well, again, if you go to a renal dialysis ward, you'll find that half the people on dialysis will have diabetes. Okay? So it's far overrepresented. If you go to a ward where they do amputations, 70% of the people in that ward who've had an amputation will be a diabetic. Okay? So again, it's a very important source of morbidity and mortality. So really, what options? He's on metformin. Again, you're not physicians, so you don't know what the dose is, but he's actually on a high dose, or what I feel is the maximum dose of metformin he should be on. A gram BID is a very good dose, so I would increase the dose of that. I certainly would send them off to a diabetes center. Diabetes centers have nurses, they have dietitians. If you're lucky, they'll have an exercise person. And that really is one of the key things to get your sugars under control. It's very tough to do, but if you can get lifestyle measures, that's one of the best things you can do to get sugars under control. Now, in terms of how to treat this individual, his sugars are high, he's on the highest dose of metformin. I would put him on a second agent to lower his sugars. The challenge to physicians is, which one do you choose? And I'll briefly go over that. But we actually have a lot of choice to treat diabetes, but there's pros and cons to each of these. One is body weight, risk of hypoglycemia, and how well the patient tolerates the medication. And that's one of the emerging challenges, is what is the best drug to add to metformin? Now, how many of you have had relatives who have had to go on insulin? Okay, so a lot of people have had that. What do people fear when they go on insulin?
Side effects.
Which side effects?
Pardon me?
What side effects?
Well, I guess there's a variety, but there's dizziness, lightheadedness.
So that can be a sign of low blood sugars. So insulin can cause low sugars. It can cause weight gain. I guess when you ask people, they say, well, geez, so-and-so, my relative went on insulin, and within a year they were dead. So really, there's a lot of misconceptions out there that once you're on insulin, it's game over. And we got to get around that. A lot of people have been on insulin for 10, 15, 20 years, and they've done incredibly well. Okay? All right, reinforce. And again, Karen's going to do a much better job than I am. As she will show you, you can reduce A1C very impressively, as good as a drug, by getting people to eat better. And she will tell you about things like carbs. She'll tell you about glycemic index, which is a very powerful tool to improve the way your body handles glucose. Again, I don't know, is Canada Food Guide a good or a bad thing?
It's a good guide.
Okay, she says it's a good guide. So again, it gives you some guidelines of what you should eat. The last one's often a challenge for a lot of people, 1 to 2 drinks a day. And again, she'll tell you if this is a bad or a good one. Okay? Wait, I showed this last time I was here. The reason I put that up is, again, if you got diabetes and you smoke, that's an incredibly lethal combination. And you just ask them for trouble if you do that. If you really want to kill yourself, just smoke and have diabetes. Physical activity, again, it's amazing when you measure someone's blood sugar and then get them to simply go around the block for a walk, it'll drop your sugar very effectively. You don't have to do Olympic quality exercise. A brisk walk will be good metabolically. It won't train your heart, but it will basically help with your metabolism. And again, this is motherhood statements, basically diabetes educators. It is a challenge. Doing lifestyle measures is a really challenging issue. And I actually think we do a relatively poor job currently. It's interesting, I was involved in a metabolic clinic at St. Paul's. and basically they just cut the funding for it. Again, preventative medicine isn't real sexy. It's a tough one, and I think as advocacy, we should push for this. To me, this is one of the areas that we could really improve in, especially in HIV, is improvements in things like diabetic education. So what are our goals? As I alluded to, we want to get the A1C under 7%. And the way we're going to do that is either by lifestyle or adding medications. So what are some of the agents we use to treat diabetes that are available today? Well, this diagram shows basically where they work. On the far, your left, is the liver. And the liver is a big bag of sugar. It's glycogen. And while you sleep, if you didn't have that, your sugar, your glucose would crash. It would go very low because you don't eat. So during the night, your body puts out signals and it mobilizes the glycogen in your liver. Now, unfortunately, in people with diabetes, that liver puts out too much sugar. And in the morning, you wake up and your sugars are 10, 12. That's actually where metformin has its primary action. It works on the liver, it improves the way insulin works, and by doing so, it improves glycogen output. So that's metformin. The pancreas is on the top, and as you can see, it's a target for a number of drugs. The most common one is a sulfonylurea. That's a drug that's been around for 50 years. That's a drug that you take by mouth, and what it does is it basically tells the pancreas to secrete more insulin. It's a very effective drug to get your sugars down. The only problem with it is it can cause low blood sugars, and it also will make you gain weight when you go on it. Okay? Now, there's a class of drugs known as the incretins. I'm going to tell you more about those. Those are newer agents that have been used. What they do is they regulate the release of insulin from the pancreas. They also regulate glycogen in the liver. So they have a lot of attractiveness that way. In muscle, you can use a variety of agents that improve insulin action in your skeletal muscle. That includes insulin. That includes a drug called a glitazone. And then lastly, you can look at the gut. The gut is where you absorb sugar. And if you use a drug like a glucosidase inhibitor, what that does is it inhibits the enzymes that make you absorb sugar. And by doing so, lowers your blood glucose. Now, these aren't real common drugs used. The reason why is if you take these drugs and you eat carbs, they'll go right through you. Your bacteria will digest those carbs, and you'll have major gas issues. So you pay the price if you use that. So you have to educate the person when you use these. So that's the choice. So if a person's failing on metformin, you have to choose one of these. And there's pros and cons to each of these. And again, these are listed in the Canadian guidelines. Again, I'm not going to bore you with this, but the general thing is you want to look at drugs that don't cause low blood sugars, and you want drugs that don't make you gain weight, and that's a real challenge. Certainly, insulin is a very powerful agent to lower your A1C, but it can cause low sugars, and you will gain about 5 kilos when you go on it. Okay? So that's why in the diabetes world, there's a lot of excitement regarding incretin-based therapies. Again, this is my last set of physiology slides. Incretin is a hormone system that basically regulates the release of insulin from your pancreas and another hormone called glucagon. Nature has evolved a way that the gut talks to your pancreas. This was originally discovered when they took people and they gave them either glucose by mouth or they injected them IV. And they found that when you gave glucose by mouth, you got a much more robust release of insulin, and it lowered your sugar very effectively. And that was subsequently called the incretin effect. And people with diabetes, they don't make enough of this hormone. So that when you eat sugar, you don't release enough of the incretin, and by doing so, you don't release enough insulin, and your sugar goes up. Now, until recently, we couldn't do much about that. We now can increase incretin levels, specifically GLP, in your blood. You can do that by using a drug that inhibits the enzyme that breaks it down, that's DPP-4, or you can inject a synthetic form of GLP. And it's a very powerful agent to lower your blood sugar. So it will release insulin, it will suppress glucagon. The other thing is if you use the synthetic forms of GLP, it can profoundly affect your satiety, the feeling of being full, and people who go on this will lose weight. Now, I don't know if anybody has heard about this, but I've used this in about at least 50 people with HIV. This is a drug called Victoza. It basically, one, it controls sugars very well. Two, it helps remove the body fat that accumulates in people with HIV. So again, that's off-label, but that's something that I've used successfully in a number of individuals. The only challenge with this class of medication is they're expensive and the government won't cover them. Okay? So, just to finish off, here's a guy failing on metformin. As I alluded to, should you increase the metformin? And the answer is no. Once you get above 2 grams a day, which is 2,000 milligrams, the effects on lowering A1C diminish. It's really not effective to do so. What about adding a second agent? Well, again, you got to pick ones that do not make you gain weight, don't let you get hypoglycemia, and they reduce A1C. And again, that's a challenge. And that's what the whole science of diabetes is finding medications that minimize the side effects, but are effective agents to lower your A1C. So again, in terms of body weight, as I alluded to, a number of different agents will make you gain weight. Sulfonylureas, the glitazones, insulin will make you gain weight. Whereas the newer agents, such as the DPP-4 inhibitors and metformin, actually make you lose weight. So that's an incredibly attractive advantage. And in terms of weight gain, this is also shown here. This is from a very famous study called UKPDS. The red line shows people going on insulin, and as I alluded to, you'll gain 5 to 6 kilos when you go on insulin, whereas when you go on metformin, your weight stays stable. One of the challenges in diabetes, as I alluded to, is once you've had diabetes, you've lost 50% of your beta cells, and they're not coming back. And as this slide shows, with time, you continue to lose beta cells. This is despite therapy with lifestyle and the early drugs used like metformin or insulin. One of the holy grails of diabetology is, can you prevent this inevitable decline in beta cells? So this is what I do in people with type 2 diabetes. If they're insulin deficient, if they're peeing through the night, they got symptoms, you put them on insulin, get them under control. If they're obese and overweight, you use metformin up front. And then if they're failing on metformin, your challenges are, what's the second drug you add? Certainly if you're overweight, your BMI is over 35, I tend to use GLP analogs. If your BMI is under 35, I tend to use sulfonylureas. And if the patient can afford it, DPP-4 inhibitors. And again, in the case of Mr. Jones, if you looked at a variety of specialists, this is what they would have chosen to add to this person. Who recognizes this guy? Well, he's the Hooli medicine man. That means I'm going to finish off here. Basically, the key message is lifestyle measures are always additive to going on a medication. In terms of drug therapy, the challenge is what medication do you add to metformin? And again, you got to balance the ability to lower A1C with side effects such as low blood sugar and weight gain. And again, your A1C will influence how much you can lower. So I'll end there, and I'll let Karen take over, and if you have any burning questions, I'll answer it right now. Sure.
You talked about one of the drugs, and you said if the patient can afford it, does that mean the government will pay for it?
Okay, so the question is, which medications will the government pay for? The newer agents are expensive, okay? Now, they will cover the DPP-4 inhibitors. They will, but you have to fail on metformin and you have to fail on sulfonylurea. And if you failed on both of those and you refuse to go on insulin, they will cover a DPP-4 inhibitor. So they do make you go through a number of hoops, but they will cover it. They won't cover the incretin, the injectables. That's, again, the one that I alluded to. That's an effective agent to get sugars down and get weight loss. They are applying for that, but it always takes time for that to happen. Okay. You want me to take questions, or?
You can take a couple.
Okay, sure. Go ahead.
Yeah, I was wondering what the incidence or prevalence rate is for people that are predisposed, like to like their ancestors and that, like relatives, and they're getting diabetes.
I'm not sure if I heard your entire question, but did you say that they're prone to infections themselves?
Well, no, what I'm asking is that if a person is predisposed in the sense that their relatives have it, or ancestry, what is the chances of that individual getting it?
Okay. So again, who's predisposed to getting diabetes? Is that
Well,
correct?
like say for example,
And, so people who are at risk for diabetes, one of the most powerful tools to predict risk of diabetes is people in the family who's had diabetes. So if your mom or dad has had diabetes, your chances of getting diabetes are about 50%. If you've got a brother or sister who's got diabetes, your chances of getting diabetes are also increased close to 50%.
So is there any way we can avert that to maybe dietary or exercise? Or
Yep. So again,
prolong it, or maybe prolong getting it?
so if you have a predisposition to diabetes, the genetic or family history tells you about it. Your biochemistry also tells you about it. If the person has an elevated fasting sugar, if the person has a particular lipid profile, that is clues that that person's at risk for diabetes. What do you do about it once you know that? Well, body weight is a very powerful predictor. So if you're overweight, you got to lose the weight. Exercise is also a very powerful tool to prevent diabetes. In fact, there's a very large trial called the Diabetes Prevention Trial. It took people exactly the way you said, people who were at risk for diabetes. They got them exercising 4 days a week. They got them eating well. And indeed, the exercise was really quite, they had to do this. In fact, if they didn't go to the gym, someone would send a cab to pick them up to bring them to the gym. So if they did that, they reduced progression to diabetes by 60%. So there's things you can do about it.
So they just actually reduce the progression.
Well, that's, again, you delay the progression. Actually, the more you can delay it, the more you're going to prevent the complications.
Right. Okay, that's
Sure,
answered my question.
sure. One more and then we'll switch.
What about the effect of adding chromium glucose tolerance factor to that? Will that help?
Okay, so the question is, what about supplements like chromium to help with preventing diabetes? They have done this in animals, and it does work. The only problem with chromium is it's very toxic. Okay?
Well, their maximum take no more than 200 micrograms, no more than 400 micrograms per day.
Yeah. But again, the ability to prevent or to improve glycemic usually require higher doses than that, and really in people, it's never been an effective strategy. They have tried modifying a variety of molecules like chromium, but they haven't had any success. Now Karen can tell you more about things like cinnamon, other drugs, not drugs, supplements that have been tried to treat diabetes. Again, it's still an open question. And I can't give you any firm guidance on that.
Well, I tried it myself in the last month and a half or two, and I'm finding my sugar readings are better since I've been taking a 200 microgram pill twice a day.
That's good. Have you lost weight at all?
Yes, I have lost.
And usually when you lose the weight, that's probably what's helping as well. The other thing is when you talk about diabetes, you always got to look long term. It's like an investment. A lot of people, you can get the sugars down within 3 months. the ability to have durable response, say after a year, is one of the challenges. Okay, I'm going to stick around after, but let's move on to the next presentation.
Okay, so I'd just like to thank Dr. Bondy for that very informative talk. I know I learned a lot. And so you've heard a lot about treatment, so what about prevention? So that's why we have Karen Morton, registered dietitian, here to speak with us tonight. Karen holds a Bachelor of Science in Nutrition from UBC and did her nutritional internship at St. Michael's Hospital in Toronto. So Karen works as a clinical dietitian in the Healthy Heart program at St. Paul's Hospital and does nutrition care and education in both individual and group settings. She's provided nutrition seminars, this is really impressive, to over 5,000 people, including cardiologists, physicians, dietitians, nurses, athletes, people with chronic disease, and the general public. She's also involved in spreading the message of healthy eating through the media. She's a member in good standing with both Dietitians of Canada and the BC College of Dietitians. And when she's not busy coaching others to eat better, you can find her on the running trail, skiing at Whistler Blackcomb, or inline skating at the seawall. So without further ado, please welcome Karen Morton.
Thank you, Jen, for that very kind introduction. Okay, so good evening, everyone. There. Can everybody at the back hear me okay? Okay, great. So tonight I thought we'd do a few question answers throughout this presentation just to make it a bit more lively, to check our knowledge. And we'll just start with the outline right away. So tonight we're going to talk about carbohydrates 101. What are they? And specifically talking about the glycemic index for those of you, and we'll see if we can guess which foods are high or low in glycemic index. A couple of them kind of fooled me when I was first learning about it. As well as 6 steps to prevent or delay diabetes, type 2, so we'll definitely be looking into those. Restaurant eating, okay, that's where the diet, or think about all-inclusive vacations. What do we do in those scenarios? So we got some tips for those, as well as a word about exercise. Okay, we'll start with carbohydrates 101. So, what are carbohydrates anyway? Well, I just made it quite simple here, but basically they're a component of food, so such as a sandwich, they do have carbohydrates, and when we eat them, they basically turn into energy in our body or glucose, and that provides us with energy. So we do need to eat carbohydrates to have energy to do our activities of daily living or to basically function properly. So foods that contain carbohydrate are fruit, and the fruit sugar that's found in there is called fructose. Grain products and potatoes are at the very top there. They are full of starch molecules, which are little chains of glucose, all linked together. Then yogurt and milk, they also are carbohydrates in the form of lactose, which when broken down, breaks down into glucose and galactose. And for some of us that are lactose intolerant, we lack that enzyme. And we get gas and bloating after drinking milk or eating yogurt. The nifty thing is there are lactate pills or lactate milk that you can have to compensate for that, so you tolerate milk a little bit better. And of course, other carbohydrates are food that turn into sugar, such as sucrose or table sugar, which is glucose and fructose together. Pop. Back in the 70s in pop, we put cane sugar in there. Now we put high fructose corn syrup in our pop, which is quite dangerous, not a healthy thing. Juice itself, which has the same fruit sugar as fruit, fructose, honey, and as well candy. So all these foods are carbohydrates. We want to watch how much of these we're eating at one time because they can raise blood sugars. So what is the glycemic index? Who here has heard of the glycemic index in this group? If you could raise your hands, please. So find a few people. Okay. So what is the glycemic index? Well, it basically ranks carbohydrate foods by how much they raise the blood glucose in your body. And they compare it to a standard food. The international standard food is glucose, or another food that is used in some labs in white bread. It was quite interesting how they actually tested this. They tested this on people just by eating a certain food, monitoring their blood sugar for about 1 to 2, even 3 or 4 hours after, and they did 3 trials of the same food at the same time at the same day, and compared what their rise in blood sugar would be, say, compared to glucose or compared to white bread. So basically, high glycemic index foods, those turn into sugars really quickly in your blood. So an advantage of those, if you're an athlete and you need sugar right away, that would be a good opportunity to use those. However, if you are eating your breakfast and going to work and sitting at a desk, you don't want your blood sugars to spike, and then followed by a crash, you get a crash in insulin, which increases your appetite. So for the most part, we want to have low glycemic index foods. Those are foods that turn into sugar more slowly. And by eating more low glycemic index foods, if you currently have diabetes, it'll help you control your blood sugars better. If you don't have diabetes, by eating more low glycemic index foods, it will help prevent diabetes. Okay? So when we rank them, what numbers do we use? Well, basically anything above 70, and this is compared to glucose. You might go on the internet and find out these glycemic index values, and how come they're different? That's because when they compare it to bread, it's actually going to be a higher value than compared to glucose. Okay, so that's why, because glucose is a different value. So that's why. Make sure that you're using the same tool, whether it be glucose or white bread. And anything basically that's less than 55 is considered low, moderate's 55 to 70, right in the middle. So let's see if we can rank the glycemic found in foods. So we've got some large flake oatmeal or oats there. Does anybody want to guess? What do you guys think? Is it a high glycemic index? It's going to turn into sugar quickly, or a low glycemic index? Low. Low, okay, yeah, exactly, perfect. Let's look at another food. How about Cheerios? Does that have a high glycemic index or a low glycemic index? Yeah. Oh, sorry? Medium. Medium, okay, there you go. And actually, this one is high, surprisingly enough. And bran flakes are also high as well, even though they're high fiber. French fries, high or low? High, yeah. Some people might think, well, there's a lot of fat in there. Doesn't that slow things down? But no, they're actually high. What about kidney beans? Do they have a low or high glycemic index? They're actually low. Okay, so just to give you an example. So let's look at some pictures of high glycemic index foods. Now, what affects how fast foods turn into sugar? One of them is how much they're processed. Once flours are refined to small particles, those actually have high glycemic index as opposed to the whole grain. Another factor that affects glycemic index is actually the acid content. So if we look at something like sourdough bread, even though it's a white bread, because there's acid in it, it actually has a lower glycemic index. So if we look here, white bagels, Rice Krispies, pretzels, all these basically all have a high glycemic index, and I've got handouts in the back which list a whole bunch of high and low glycemic index foods, so you can choose wisely. And bottom line is, when this is the majority of your diet, this increases the risk of diabetes and heart disease. So we want to limit these types of foods as much as we can. So limit or avoid white refined foods. That's an easy way to kind of remember it. So instead of choosing the high GI foods, let's choose the low glycemic index foods. And basically these are the foods closer to what Mother Nature meant them to be. So specific foods, pumpernickel bread has a very low glycemic index. Barley, so barley in soups would be a really good choice. That's a barley pilaf right there. Legumes, so if we think of hummus or lentil soup or say chili. We've got oat flakes, excellent breakfast. And then we've got the quinoa over there. Who here has tried quinoa? Anybody tried quinoa? Yeah, quite a few people. That's pretty exciting. Really, really good stuff. So bottom line, when you choose carbohydrate foods or starch foods, when you eat these regularly, this will reduce your risk of diabetes and will also, if you currently have diabetes, will help control your blood sugars much better. Think of that graph that I showed you before, and it definitely will reduce your risk of heart disease. So aim to choose low glycemic index foods more often. Okay, let's look at this. What can we do to prevent or delay diabetes? Let's look at 6 steps. As Dr. Bondy was talking about earlier, attain and maintain a healthy body weight. But you know something? To get benefits for your blood sugars, you don't have to be at a body mass index of 25. Losing 5 to 10% of your body weight, will automatically help control your blood sugars. Eating regular balanced meals and snacks, we'll look at portion control and a really easy way to do that. Limiting simple sugars. Increasing dietary fiber. Reducing saturated fat. And that's considered a bad fat, if you will. And trans fat, I'm going to go as far to say it's actually an evil fat, but it's something we definitely want to avoid as much as we can. And include the healthy fats. Even though, we want to cut back on the bad fats, we still want to include the healthy fats. Okay, so here's a question for you. What percentage of Canadians are overweight or obese? 60%, okay, yeah, that was a pretty easy one. Yes, you're exactly. Unfortunately, healthy weights are now in the minority. That's exactly right. So if we look at the actual numbers, it's more that, thank God, are in the overweight category, right? But unfortunately, yes, we do have a big epidemic problem. The problem with this is as soon as we're overweight, that automatically puts us at risk for diabetes. So here's the healthy weight chart, and yes, somewhere between 20 and 25 is a healthy weight, and in the back, actually, I've got a handout that can calculate your body mass index. I'll just walk through on the chart with you, but basically anything over 30 is considered overweight, but one thing to consider is we need to look at the waist measurement, because just to let you know, you can be an Olympic athlete and have a body mass index of 30, but say your waist is 34, right? So for instance, if an Olympic athlete has a body fat percentage of say 4 or 5% and their body mass index is 30, would you guys consider that person obese? No, exactly, right? So it's all about the waist circumference as well. A lot of men do better at body mass index 27, for instance, as long as they have a smaller waist. And keep in mind, say a person is overweight, they weigh 200 pounds, and they lose, say, anywhere from 10 to 20 pounds, that will automatically improve their blood sugar. Is there a question in the back
I
here?
just noticed it said underweight less than 25, which isn't a healthy weight.
Oh, thank you. Thank you very much. That is a mistake on my slide. It should be less than 20. My apologies. Thank you very much. Less than 20 is considered underweight as a guidance. Okay, so this is a table that we have at the back in one of the handouts, and basically if you just go down the side, you find, because everybody can calculate their own body mass index, and then you go across and you find your weight, and then you go up, and then you find your body mass index. So just a really easy chart to do, and again, they're just available at the back, and they're actually, let's see what color did I put them on. They're actually on the back of a purple sheet. Okay, so you can grab one of those on the way out. Okay. So what I was mentioning before, if you're a male and you have a waist bigger than 40, that puts you at an increased risk of heart disease. So losing that through exercise, through changing your diet, very beneficial in losing or reducing your risk of diabetes. For women, it's 35 inches. And these are for Caucasian men and women. If you're Asian, it's actually slightly less than this. Okay, so I wanted to give you a couple definitions, because we want to, basically, if you do lose weight, you want to be able to keep the weight off for the duration. So here's a definition for you. Dieting, that is the smallest number of calories and the greatest amount of exercise that a patient or a person can tolerate. Okay, that's dieting. Healthy lifestyle is actually the smallest number of calories and the most amount of exercise you can enjoy. Okay, so just think about where, say you do need to lose weight, think about what you're currently doing now. Is there any changes that you can make in your diet to cut back on calories, and are these things that you can live with for the long term? Because sure, you know, if we go on a radical diet, you know, where we lose significant weight and we make all these changes, if we can't maintain the changes, we can't maintain the weight loss. So here's another definition. This is, who's heard of the National Weight Control Registry? Anybody heard of the National Weight Control Registry? This is a physician who studies patients who have had huge success at losing weight. And to be part of the National Weight Control Registry, a person would have had to have lost 30 pounds and kept it off for at least 1 year. That's just to register. And they're tracking about 10,000 patients. And the average is actually people have lost 60 pounds and kept it off for at least 5 years. So it's quite significant. And bottom line is the key to long-term maintenance of weight loss is the long-term maintenance of behavior change. So just keep that in mind if you want to make any lifestyle changes in your diet. Okay, so let's look at breakfast. Which statement is false about breakfast skippers? Do they eat more calories later in the day? Do they tend to be more overweight? Yeah. They don't gain weight over time, or they think they eat less. Which one is false? Which one do you guys think? Who thinks it's 3? You people? Yeah, most people. Okay. Anybody think it's 1? Anybody think it's 4? Okay, person in the back. Okay. So actually, a majority of the people say you don't gain weight over time. In fact, you do. And remember those weight control registry people that have lost weight, kept it off? 95% of them eat breakfast. Okay? So what are the dangers of breakfast skipping? Yes, you tend to gain more weight over time. You think you eat less, but actually eat more calories later in the day to compensate. And then you also have an inconsistent food intake. And think about, all of a sudden loading up with carbohydrates from fasting and not eating leads to poor glycemic control. And think about if you haven't eaten all day, what's your hunger level going to be by the end of the day if you haven't eaten much during the day? Do you think, even if we have the best intentions to eat like a healthy meal, reasonable portions, if we're super hungry, what's going to happen? Yeah, we're gonna eat quickly, we're gonna pig out, we're gonna eat more than we would intend to, just like this poor little kitty here. It didn't get a chance to eat all day. So what did it do by the end of the day? It overate, right? Because it was starving. Okay. So that was step 1, and then step 2 is eating regular balanced meals and snacks. So ideally you want to aim to eat something healthy within 1 to 2 hours of getting up. So let's look at what healthy means and what a balanced kind of breakfast means. So something like this would be a balanced breakfast. Because we have the protein, which is your almond butter in the meal. We also have a starch, which is your whole grain bread. And we have a fruit, which is your banana. So that would be considered a balanced breakfast. And then we got a latte there, an Americano, whatever you like. And actually, just a note about coffee drinkers. Now we're not talking the frappuccinos with all the cream and all the sugar. But regular coffee drinkers actually have a reduced risk of diabetes. Now I'm going to qualify that as you don't want to overdo your caffeine either, right? This is for 1 or 2 cups of coffee a day. We're not talking about the big, huge venti size. We're talking about an 8-ounce cup of coffee, because overdoing caffeine is not good for your heart either. So having 1 to 2 cups of coffee a day, no problem. Preferably black, not with lots of sugar, preferably with skim milk. Okay, another really good breakfast cereal would be something like bran buds with psyllium. Psyllium is a very high viscous or soluble fiber food, which actually can lower your blood sugar, okay, and also lower cholesterol. And then so we've got the starch, which is your high fiber cereal, your fruit, and a protein. You can throw some nuts in there. So those are just some ideas of what to have breakfast. So for those of you that you really don't eat breakfast because maybe you feel nauseated in the morning, you overate at night, even if you can start with a piece of fruit or grab something in the morning, you'll have significant health benefits. Okay, so ideally you want to fuel your body every 3 to 4 hours, roughly speaking. And if your meals are greater than 4 to 5 hours apart, it's a good idea to have a healthy snack. Just think about it. If you have breakfast at 9 o'clock and your lunch is at noon, you probably aren't going to need a snack, right? Because there's only 3 hours in between. But if your breakfast is at 6 in the morning and lunch is not till 1 o'clock, that's 7 hours difference. You will definitely need a snack. And especially if you're on a medication, if you're on insulin, you're definitely going to need a carbohydrate in between. Or if you're on any of those sulfonurases, like glyburide, then you're going to need a snack, okay, to prevent low blood sugars in between. Okay, now I have a question for you. Is this a balanced meal? This is spaghetti and tomato sauce. And it's 2 cups of cooked pasta with 1 cup of tomato sauce. Plus we're going to add a salad to it. So that's 2 cups of salad with 2 tablespoons of light dressing. Now, what do you guys think? Is this a balanced meal? I see a shaking head, no, and a hand up at the back, yes.
Is the spaghetti whole wheat?
Yeah, we could make it whole wheat. We could definitely, yeah.
Whole wheat probably is about.
Probably is not, yeah. We have a hand
It's
up.
a balance. The athlete, I'd say, is in like a runner.
Balanced meal for a runner, yeah. There would be a lot of carbohydrate there for the runner, yes.
There's no protein.
You need some protein in there.
Exactly. There's no protein in there, and this is quite a high amount of carbohydrate, okay? I went onto one of the nutrition programs, and that's 100 grams of carbohydrate, which is a lot. Most people with diabetes, or if you're aiming to prevent diabetes, you're probably aiming for about 60 grams, maybe 70 grams of carbohydrate in a meal, okay? So it's way too much sugar. That's like 20 packages of sugar. And that has to do with the pasta that's in the meal and the tomato sauce, okay? Yes?
If it were whole wheat, would it be okay or no? Besides a little protein?
It depends on your energy needs, but it's still a pretty bit high. Like I would aim for probably more 1 cup of pasta or 1.5 cups of pasta, and then loading it up more, keeping the vegetables in there and adding the protein, and that would be a better choice. But it's still, that amount of carbohydrate one time is too high. We're going to look into see how much a good amount of carbohydrate is. Yes?
What if it was gluten-free pasta?
It wouldn't really make a difference difference, and in fact, some of the gluten-free pastas actually have a higher glycemic index, like the rice noodles. Corn noodles would be a better choice, but yeah, no, it wouldn't make a balanced meal. But the biggest thing, not only with too many grams of carbohydrate, but there's no protein foods in there. So what could you add to this to make it balanced? What could you do? Oh yeah, you could add some meat to it, yeah.
Cheese.
Cheese, a little bit of cheese. I have lower fat cheese. Soy. Legumes, exactly. Taking away some of those noodles and adding some legumes or adding some tofu, much better choice. Okay, so if we look at what a balanced meal is, and this plate, just to let you know, everybody's got, this is on the yellow piece of paper, okay? So, and I'm wondering, should I just get these handed out? Or should we wait till the end? Yeah, just so I can have them, maybe to have a look at, that'd be great. Okay, so, an easy way to do that is, say you don't feel like counting carbohydrates, we'll just start with something that's very, very basic by using your hands. You have a hand, this is on your yellow handout that will be coming around, your handy plate portions. And so this will be a lunch and supper plate. So, if you think of your fists, now it depends on the size of your fist. Some guys have really, really big fists, so you probably want to take 3/4 of your fist, right? But if you have an average size fist, that would be a good size to aim for your grains or starches. So anytime you eat rice, potato, pasta, any grain products, no more than about the size of your fist at one time, okay? So you can have, say, one fist at lunch, one fist at dinner, one fist at breakfast. Next one, this is the biggest part, right? 2 hands for vegetables, okay? Because vegetables in general do not turn into sugar. So, and the leafy greens particularly can reduce your risk of diabetes. So definitely 2 hands of vegetables. And for your protein portion, just the size of your palm. And that would be for your dinner meal, about the size of your palm, and maybe half a palm for your lunch meal. And again, if you have a huge palm, you might want to go 3/4 of your palm. And what about fruit? A lot of people ask me, well, I can't eat fruit, it has sugar in it, you know, I'm going to cut it out. Actually, fruit is full of antioxidants and will protect you against heart disease. And for every fruit and vegetable serving you eat will lower your risk of heart disease, each individual one by 4%. So it all adds up. Okay, oh, and I forgot the healthy fats. We'll get to the fruit in a second. Healthy fats are just the size of the end of your thumb. So that's any oil in cooking, any salad dressing that you might use, any spreads like margarine, okay, and that would be the size of your thumb. But think about it, if you're making a huge pot of chili and say it's making 10 portions, then you could use 10 thumbs in that pot of chili. And then the fruit, just think of when you're eating fruit, no more than your fist size or 3/4 of a fist at one time. Eat all fruit, and maybe up to 3 or 4 times a day. Okay, and a lot of people think, you know, they avoid certain fruits because of the, some fruits are high in glycemic index, so I'm going to avoid those. But actually, it's more about the portion size of your fruit, so keeping the portions down to these sizes. The only place I would apply glycemic index to is to your grain products, okay, or the starches. Okay, so healthy snacks. What are some healthy snacks? Hummus and baby carrots. We've got protein, which is in your hummus and your baby carrots. Really easy snack. You can pick this up at the deli. Another really good snack, peanut butter and apples, grapes, and notice how their portion size, your fist size, and cottage cheese and cantaloupe. So these are just some examples of healthy snacks to have between meals. Okay, so we're moving on to simple sugars. Okay, so which of the following beverages contain the most sugar? Is it A, a can of Pepsi, a 355 ml can of Pepsi? Is it a bottle of vitamin water essential, or is it a medium, that's a Dairy Queen Arctic Rush, or is it a grande iced tea from Starbucks? Anybody want to guess which has the most sugar? The iced tea, okay.
The lemon.
The lemon, I see the lemon, okay. The vitamin. Let's have a look here. I wasn't sure either. I actually had to look these up. But these are how many teaspoons of sugar are found in each one. There's actually 21 teaspoons of sugar in that Arctic Rush. So that would have the most, right? So, you know, this is a place where you definitely want to decrease your simple sugar intake.
Can I ask you another question?
Oh, yeah, sure, yeah, go ahead. No questions that are done, yeah.
What is an Arctic Rush? I have no idea.
Oh, it's like kind of like a Slurpee, you know, kind of like Slurpee with ice, something you have in the summertime, something like that, yeah. But you know something? The can of pop was basically 350 mils, the Arctic brush is more like 595. If we made the pot that big, it would be very similar. Okay, so how much sugar? You definitely want to limit your simple sugars to prevent or delay diabetes. Okay, so bottom line is, yes, you can have sugar, you just want to limit the amount. So a good statement from the American Heart Association says for women, no more than 6 teaspoons of added sugar per day. And for men, no more than 9 teaspoons of added sugar per day. But keep in mind that's also the sugar hidden in food. So when you're reading your labels on your granola bars, when you're looking at your cereals, it includes that full amount. And a lot of people ask me, well, what about agave nectar? Sorry, I'm having fun with the clicker there. There we go. So I put a rose up there because a lot of people say, well, I'm having maple syrup, I'm having brown sugar, I'm having agave nectar, I'm having brown rice syrup. So, bottom line is it's all sugar. Sure, maple syrup or honey has a few more antioxidants than white table sugar, but sugar is sugar. It'll still raise your blood sugars. So bottom line, you want to limit it to a maximum of this amount in your diet. So 9 teaspoons or 150 calories. And just to give you an idea, a can of Coke is 9 teaspoons of sugar, a half liter is 12, and a full liter is 24 teaspoons of sugar. So far too much. So instead of going for the regular pop, oops, so I'm having fun with the clippers here. There we go. Go for the diet soda instead. Sorry, I don't know what I can do this. There we go. Okay, so instead of going for the regular pop, go for the diet pop, because sugar we know will definitely increase your blood sugar. So instead of a glass of orange juice, next time choose an orange. Much less concentration of sugar in there and much more satisfying, and the soluble fiber will help lower your blood sugars and your cholesterol. And make water fun. Put fruit in it. Sometimes you can put cucumber in your water. You can put, yes, most people know about the lemon lime. You can also put orange slices in there or strawberries. And instead of table sugar, Splenda, much better choice. And for your jam, choose the triple fruit jam. Just typical tips on how to cut back on sugar in your diet.
Excuse me?
Yes.
What about, what does aspartame do to your body? Isn't it not very good for you either?
Sure, and just to let you know, that was Splenda, so that's sucralose. It's considered the safest out of artificial sweeteners. Aspartame's a little bit different. That's 2 amino acids kind of bound together. And that's found more in diet pop, but it's not used as much. And just to let you know, aspartame, according to the FDA and Health Canada, is safe in pregnancy actually. So, but I don't have a crystal ball to say 100 years down the road, aspartame's 100% safe. I don't have that, but we know for sure the risk of eating too much sugar can raise your blood sugars if you have diabetes and can also increase your risk of diabetes. So if you like to eat sweet things, as an alternative, Splenda would be a good choice, or stevia would be another good choice as well. Okay, so let's move on to fiber. Which food does not contain fiber? Is it, actually, there we go. Sorry, all the clicker's clicking ahead of me. So there's 2 choices left, avocado or yogurt. Which one does not have fiber? Yogurt. You got it, exactly right, and that's a plain yogurt, exactly. So basically, fiber foods are plant foods, and really good cereals to have would be your Fiber One or your All Bran Buds, or your oatmeal to have in the morning. And also for the swirly bread, those Silver Hills bread, each slice has 5 grams of fiber. So by eating 2 slices, like for toast in the morning or as a sandwich, you're going to get 10 grams of fiber. And the daily goal would be anywhere from 25 to roughly 40 grams of fiber per day. Okay? And obviously your fruits and vegetables will give you fiber. Barley's an excellent source. Your legumes again. So definitely eat more high fiber foods and whole grains, and that will reduce your risk of diabetes and also help control your blood sugars. Okay. So now let's see how much fruits and vegetables will lower the risk of heart disease. I mentioned 1 serving lowers your risk by 4%, but consuming your 7 servings of fruits and vegetables a day, how much can you lower your heart disease risk by? Is it 70%, 10%, 30%, or not at all? 30%. Yeah, you got it, exactly. That's for your 7 servings a day. So every one of these, because remember what Dr. Bondy was saying, heart disease is the #1 killer for people with diabetes. So if you can considerably lower your risk of heart disease, this would be, a good option. Eat your fruits and vegetables. So what is a serving anyway? We don't, as dietitians, we're always talking about servings. Basically, it's a medium piece of fruit or vegetable. It would be half a cup of berries, chopped fruit, or cut vegetables. They're not really that big. Or a cup of salad. So if you're looking at your leafy greens, it's a little bit more. And an easier way to remember it, just think of a tennis ball. That's the size of a serving of fruit and vegetables. And I've got my little mouse up here, which is also the size of a salad, if you will, and half the mouse would be if it were, say, raw vegetables. Okay. And I put here the leafy greens. Anybody kale chips? Maybe try kale chips? Yeah, excellent. Yeah, wonderful. Or if you like, all tonight we had that lovely green salad. We had also romaine lettuce. By eating at least 1.5 servings of these every day lowers our risk of diabetes. So something to think about including, putting lettuce in your sandwiches, having salad more often, steaming the greens, a really good choice. Okay. So here's just some quick tips on increasing fruits and vegetables. Bottom line is eat more of the ones you like, okay, to start out with. And over time, you'd be surprised. Taste buds do change. The more you eat healthy foods, the more you actually like them. Barbara Rolls is a scientist from Penn State University that just showed that recently in her volumetrics book. Keep your frozen fruits and vegetables in the freezer so you always have them on hand. Include fruit at breakfast, lunch, and dinner. Fruit are great snacks. Okay, think of the plate. So half your plate, ideally vegetables. Fruit juice doesn't count. Replace one way to get more veggies in your diet. Remember that pasta plate before? Take away half the pasta, load it up with more vegetables. And when you're having dips like hummus or tzatziki, think about the baby carrots or celery dipping, or even the bell peppers cut up into slices. Okay, so step 5, we're almost there. So we definitely want to reduce the bad fats in the diet. So saturated fat, that's basically found in animals, and it's solid at room temperature. So things like butter, you're much better off to choose margarine. When you're eating cheese, choose the lower fat cheese. This is the part I don't like about my job, but cheese is actually a high saturated fat food. So I usually tell people if you don't like the low fat cheeses, think of cheese as a treat food. Cream, whipping cream, ice cream, cream, and coffee. High fat dairy products also increase your risk of heart disease and diabetes. So think of going with 1% or skim milk instead. And limiting especially the processed meats. Processed meats such as salami, bacon, sausage, all those actually increase the risk of diabetes. So this is one thing, if you want to reduce your risk, to limit this as much as you can.
Excuse me?
Yes.
In the corner show coconut oil.
Oh, yes. Let's go back. Yeah, coconut oil, I'll just talk about that. I'm not having fun with the clicker tonight, so. Coconut oil actually is 90% saturated. I know there's a big debate about coconut oil right now, but because it's so high in saturated fat, bottom line is it will increase your cholesterol, and we definitely want you to limit coconut oil. If you do like, say, Thai curries and you really miss that, we suggest to go for a lower fat. They do have a light coconut milk that's much lower in fat than the regular coconut, but that's something you definitely want to limit.
Are you talking about LDL?
Yes, yeah, your coconut will raise your LDL cholesterol.
Everything I've read said the opposite.
It depends what it's compared to. For instance, if it's compared to butter, it doesn't raise cholesterol as much as butter does. But if you compare it to, say, olive oil, if you compare it to canola oil, it will definitely raise your cholesterol. So definitely something you want to limit. It's 90% saturated. Yep.
We do have a certain need for saturated fats, so don't we?
Oh yeah, like with saturated fat, we're not saying totally avoid it, you just want to limit it. So, like for men is an example, no more than 15 to 20 grams a day if you have high cholesterol, but we're not saying cut it out altogether. You will get some in your diet just by eating a small amount of animals. Yeah.
Yeah, I'm kind of concerned because I've heard both sides of the spectrum, and I think basically it's concluded that it is beneficial. Coconut oil.
Not for heart health. Definitely not for
That's
heart
the
health.
only, because I know it absorbs your body fat. It'll actually cleanse the body fat out of your stomach. That's one of the benefits.
No, unfortunately, the bottom line is, like, when you increase the saturated fat, regardless if it comes from butter, if it comes from coconut oil, say compared to olive oil and canola oil, it will raise your LDL cholesterol, and having a high LDL cholesterol raises your risk of heart disease.
But say, for example, if I was to take fat from an avocado, that would increase
That's a healthy,
my health. See, but that's what I'm saying
fat.
to you, isn't it?
Oh yeah, we definitely want to talk about healthy fats. That's
So this is what I'm kind of confused,
Oh,
because I'm leaning to the coconut oil is good. That's what I'm saying.
You can discuss that individually with your dietitian, but it's still not a good choice. So anyway, okay, so the other fat that is an unhealthy fat would be trans fat. This is the one you want to limit as much as you can. I've seen some studies where even 1 gram of trans fat increases your risk of heart disease by about 28%. So it's actually, something really you want to stay away from. And so let's see what's happening. There we go. Okay. So trans fat, how do we know it's in foods? We look at the word hydrogenation, partially hydrogenated, and or vegetable oil shortening. Okay, so anytime we see these words, that means trans fat. And actually the mayor of New York has banned all trans fats in their city, right? Because they're quite harmful, they're man-made. If we think of the structure of them, they're actually very stiff. They're not fluid like a really cis molecule like natural fats. So think of your arteries, and all our arteries and our cells in our body are made of fat. So if we've got trans fat as the building blocks, that actually will create stiff arteries, increase your risk of heart disease. Okay, so we're getting to the healthy fats. First of all, we're talking about how much total fat. So how much total fat per day is a healthy intake? It's 4 to 5 tablespoons? Is it 1 tablespoon, 2 to 3, or absolutely no fat whatsoever? What do you guys think? 2 to 3. You got it, exactly. We do want to include healthy fats in our diet, and here's where your avocado is. These are the fats you want to include. You definitely don't want to follow a no-fat diet. You want to include healthy fats in your diet. The 2 best oils to use are olive oil and canola oil. Canola oil has a higher smoke point. It's a very good choice for higher temperature cooking. Olive oil you'd be using for salad dressing or lower temperature cooking. Nuts, actually by eating them regularly, just not too many of them. How much? Probably about a 1/4 cup per day. And that reduces your risk of heart disease as well. Avocado. These are full of monounsaturated fat, and the last ones over there are fish and seafood. Aiming to eat that 2 to 3 times per week will lower your risk of heart disease as well. Okay, so those were the 6 steps. We'll quickly look at restaurants, and then we'll talk a little bit about exercise. But portion size have grown. Like if you go to a restaurant, you know that there's a lot more calories. If we look at a chicken Caesar salad, say 25 years ago, it was 390 calories. The portion was maybe 1.5 cups. Today, that chicken Caesar salad is 790 calories, 3.5 cups. The difference is 400 calories right there, okay? So if we look at a muffin, say we buy a muffin, definitely you want to cut it in half, because 25 years ago or so, it was 210 calories, 525 calories, okay? And look at 15 teaspoons of sugar. So that is actually, a huge, that's one of the larger size muffins, but definitely something you want to limit in your diet. If you're going to eat something like this, definitely cut it in half, share it, or choose a healthier option. So that's 315 calories or 10 teaspoons of sugar from a muffin from before. So definitely restaurant meals. Let's look at what we can do. So definitely eating at home more often will definitely reduce your risk of diabetes and heart disease. Okay, and if you do choose to eat out, ideally, in a perfect world, limit your restaurant meals less than 2 to 3 times a week. But if you can't do that, aim to choose wisely. So split an entree with a friend. You'll cut the calories right in half. An average entree has about 1,000 calories in a restaurant, so they're very high. Order an appetizer as a meal. Maybe try the child's plate. Decide ahead of time how much and what you're going to eat. So get the doggy bag ahead of time. If we have the huge plate in front of us, we tend to overeat it, right? So if you pre-portion it ahead of time, or complement an entree with a salad. Okay, so word about exercise. Aim to be active for at least 30-60 minutes on most days. That will automatically lower your blood sugars and reduce your risk of heart disease, decrease your blood pressure, help you lose weight, reduce your diabetes, all the things that we're talking about. But Dr. Bondy can speak to this too, but consult your doctor before beginning, but start slowly and increase gradually. Okay, so I'll leave you with a quote here. And so start by doing what's necessary, then what's possible, and suddenly you're doing the impossible. So short steps at a time. That's St. Francis of Assisi. Thanks for listening. Okay, so
So thank you, Karen, for sharing that information with us. Definitely lots of practical tips in there. We have about 15 minutes left now, so I'd like to welcome both of our speakers up to the front of the room here, and we'll have some time for a few more questions and answers before we end tonight's evening. Okay, yes.
Dr. Bondy, you spoke a lot about high glycemic foods increasing diabetes and heart disease, and the last talk about nutrition, you didn't seem to focus on that a lot, and indeed saying eating carrots for snacks. I heard that carrots are very high in glycemic index, and so I'm wondering why you didn't mention a lot of that in your talk about nutrition.
So the question was talking about vegetables for glycemic index. Was that the question?
Well, just not focusing a lot about high glycemic. You're talking about sugars a lot, but other foods that are high in glycemic index.
Sure.
I was taking, for example, carrots.
Yeah, so the problem is when we apply the glycemic index to fruits and vegetables, we miss out on all those other nutrients. For instance, carrots are full of beta-carotene, as an example, full of fiber, full of soluble fiber. And watermelon's another example that would eliminate lycopene. And so you're going to be, by applying the glycemic index to fruits and vegetables, you're going to be eliminating a lot of really healthy choices. What's more important is actually the amount of carbohydrate you give yourself at one time, so limiting your portion size of fruit or carrots, so counting them as carbohydrates. But definitely the carbohydrates found in a fruit or in a vegetable are a much better choice than, say, a white refined foods. Those are the ones to more apply the glycemic index. And if you like, there's a yellow sheet that actually talks about the glycemic index from the Canadian Diabetes Association, and actually they only include grains and legumes on that sheet. Those are the ones to really consider. Unless you say are on insulin and you're counting carbohydrates, then you would count them within your amount of carbohydrate. And that's more important, the amount, when it comes to fruits and vegetables, the amount of carbohydrate than glycemic index.
So when you're talking about portions of on your plate, fruits and vegetables,
yes.
Should we at all be concerned about the glycemic index of those?
When we're talking about fruits, yeah, fruits. That's why we talked about the fist size for the fruits. Yes, definitely the portion sizes of the fruits and vegetables that turn into sugar. Yes, the portions of those. But in general speaking, for most vegetables, with the exception of corn and potato, those you don't necessarily have to limit the portion as much.
You mentioned canola oil,
yes.
and you also mentioned Splenda.
Yes.
Could you talk about maybe some of the concerns that both of those have some real negatives?
Sure.
Especially because canola oil in Canada is all GMO.
Yeah, I can definitely speak to that. Yeah, so that's a fair question. People are concerned about that. Now, it's true. Unfortunately, due to certain multinational corporations, most of the canola oil sold in Canada is genetically modified. That's true. However, there's a brand called Spectrum where they've sourced out non-GMO organic canola oil around the world, and it's available at Choices and Whole Foods that you can buy non-GMO canola oil that's organic. So that could be one option. But yeah, canola oil for people that are concerned with GMOs, we really don't know. We don't have the science behind it to say 100% that this is, I don't have a crystal ball.
It's Roundup. It's all sprayed with Roundup.
Yeah, not the Spectrum brand.
Oh, no.
Not the Spectrum brand, right?
I'm talking about the concerns with the other.
No. I'm talking about the regular canola oil. So you can buy non-GMO, organic canola oil. And when it comes to, say, things like, for instance, your Splenda, now we know for sure, so you can have sugar in your diet. We're not saying when you have diabetes or risk of diabetes, I gave you a target there for the maximum amount of sugar. So if that's what you choose, providing your blood sugars are under good control, that's great. However, people with diabetes or with high blood sugars need a break, right? Because if they have to really cut out all the sweets, just for living, they want to include something healthy, and the risk of having high blood sugars versus the risk, like we know, like if you eat lots of sugar, right, your blood sugars are going to go through the roof. Whereas the risk of eating Splenda, it will not raise your blood sugars, so just to give them a break. And if Splenda is something, you don't have to choose Splenda if you don't want to. The FDA and Health Canada says it's safe and safe for pregnant women.
Excuse me, the FDA in Canada say that many things are safe when they aren't. They haven't even special.
Yeah, and
That's kind of a blanket.
Yeah, and I don't have a crystal ball to say 1,000 years or 4 years down the road to say, but that's the statement is they say they're safe in pregnancy. If you don't want to have Splenda, then that would be fine. There's stevia, which is another option as well, which is a natural choice. So, we're all the boss of kind of what we choose, so you can choose those instead if you like. But I agree, non-GMO is kind of a wild card, but you can definitely choose, they're all healthy alternatives out there, so there's non-GMO canola oil.
I'm just concerned that it seems that you're endorsing these things, which...
Nutrition, always a hot topic. So we have time for one more question. Or I guess, okay, 2 more, and then we'll finish up.
Yeah, I was wondering if you could possibly tell me if it's a good idea to rotate your like cooking oils, like canola along with olive oil.
Okay, so it depends on the temperature. Unfortunately, olive oil has a very low smoke point, so if you're using low temperature cooking, you can use olive oil, but if you heat it up, it actually degrades, so it's not a good idea. So probably out of all the oils to use, canola would be the best one to use for cooking. And just to add to that, a lot of people ask, well, what about grapeseed oil? That does have a very high smoke point, but unfortunately it's an omega-6 fat. And because all our pigs or cows or chickens are fed basically grains, they're very high in omega-6. So our ancestors were eating a ratio of omega-3 to 1 ratio, and now because of our food system, we're actually getting a 10 to 1 ratio. So recommending canola oil as a really good oil to use for higher temperature cooking, or peanut oil would be a good choice, and grapeseed oil less often.
Great, so our last question of the night.
You spoke about earlier sort of the max amount of sugar intake in a day, and I was just thinking, not looking at you right now, but I do long distance running on the mountain, and so quite often through a 5-6 hour run, you'll take the gels and basically that sugar, but you take 10 or 12 of them maybe, and so it's like, and especially if you're actually in a race, because you want to be maintaining sort of that peak performance level and understanding you're going to crash eventually, but you want to get through across the finish line first, in a sense, before you crash. So is there sort of a concern there that one should be aware of, that you need to figure out another food combination in there to keep that racing elevation up without spiking your sugar level to the roof?
That's a good question. Yeah, so those guidelines up there were designed for the average person, for the average daily living activities, right? So you're asking for how long do you exercise for when you're going in a race, or like
It could be a 6-7 hour race.
6-7 hours? Okay, yes.
So you're on your feet.
Yes, exactly. So you definitely want to be replacing your carbohydrate at least starting at 30 to 45 minutes.
Yeah.
And, as long as, you're burning it off, basically, at the same time you're taking it in, and that's where individually, you can get an individual consult, how many grams of carbohydrate you need per hour. A lot of athletes, they use the sports gels. Some people really can't stand the sports gels. Other people use bananas because actually they have a high glycemic index, so that, another good choice. Some people even eat potato chips while they're on the road, right? So it's all a matter of personal preference. Some people have pop, but the fizziness, it all depends what they tolerate, and if you're on a bike, right, versus running. So, it's very, very individualized. So, fructose goes into the bloodstream a little bit slower. So if you have more fruit kind of sugar base, that would slow things down a little bit. Glucose, pure glucose, is going to give you a real spike. So if you want to slow things down a little bit, choosing the ones that are more fructose based, and maybe, obviously, if you're trying something new, don't try it on the day of competition. Try something in practice. And, bananas, that's something that's a little bit slower. It's got fructose in it, and it's not going to spike your blood sugars as much as the pure glucose, like the pure gels will. So that's what I kind of recommend to kind of start out
Okay,
with.
so what I've heard that you say is that as long as you're burning it off, one-to-one in that sense, it's fine. So
Yeah, exactly.
If you
Your blood
take
sugars
your
are
10-pound bag of sugar, and you'd be okay. In that sense, or like working down.
No, it's probably more like something like 15, 20 grams of carbohydrate per hour, or something like that. So yeah, not a whole bag of sugar, right?
All right, please join me in thanking our speakers for today.